derived growth factor. But now there have been identified 23 different factors in the blood. And what we want to do is take those factors and concentrate them. Can you imagine what little bit of blood gets to your arm? Oh, just a little bit, not much. We're going to take 8 tubes of blood, which is still not a lot. We're going to take that and get all the platelets into that. That's not even a pint, dear. Don't even think of that. Barely a fourth of a pint. But anyway, it's much more than you would ever have cut, you know, even a bad head wound. But anyway, you get all those and concentrate the platelets there, and then what do you do with them? You needle them into the scalp, or you inject them into the scalp. And that is known to stimulate hair growth. Now, it's been used for scarring alopecias, it's been used for male pattern loss, female pattern loss, it's been used for alopecia areata. I have about 10 studies for alopecia areata. And when I say alopecia areata, remember that's the one with circles. If you leave those alone, many times they'll regrow on their own. You don't have to worry about them. But many times a person will come to us and they've had them for years, and we'll say within 4 treatments, we'll have that hair growing back. Yeah. And sometimes we'll do it with PRP, but sometimes we'll just do little injections of cortisone into the scalp, not affecting the body, very low concentration, and give them medicine that I can apply at night, and within 4 months, it's grown back in. 95% of the time for that one round circle, okay? Now, what if they have 4 spots? If they have 4 spots, well, it's going to take maybe 8 months. It's not going to be as easy. And then I showed you one, the ophiasis pattern, which is nearly impossible. I tell those patients, you know, I don't know how much money you want to spend on this, but this is not a really good one to treat. And I sometimes will not even, I'll be happy if the patient just doesn't ask for treatment for that. Does that make sense? Anyone's got any question about it? When we inject into the scalp, we now use laughing gas so that you can breathe on the, what I call breathe on the peace pipe, breathe on the giggly pipe, and you giggle through the treatment rather than screaming. No, you know, say ow, ow, ow. But there's at least 30 to 40 injections if you're injecting it in the scalp. Now, you can be more gentle with that, and there are chemicals that you can put on and needle them in. That's another way, that's another stimulant, and they've taken off from using the cytokines that we've used for from your own blood. You can purchase those cytokines and use those.
Dr. Griffin, so for somebody that is just starting to experience, you know, thinning hair, and they don't have, you know, maybe issues that would require surgery.
You're talking about male pattern or female pattern?
Oh, either. Okay. You know, what do you recommend typically? And is that one of the reasons why you started looking at the MONAT?
Well, certainly from the very start, you want people to begin thinking about what could be the cause of my hair loss. All right, so if you have a person, a female in particular, you might say, well, how is her thyroid doing? When is the last time someone adjusted her female hormones? So you have to think about all those things. And you know, stress gets blamed for hair loss way too much. Way too much. If you tell a person it's due to your stress, alopecia areata may be due to the stress, but the usual female pattern, if you look at it, you say, well, it's going out here and there, then that's female pattern. Then that is a patterned alopecia, just like guys going here, here, and back here. That's a pattern also. So then you have to think of what can I do to help that. There are only 2 medicines that are FDA approved for that. One is Rogaine, we just talked about it a few minutes ago, and the other is Propecia. And that's a finasteride that you take by mouth. So, and then if you start talking about all the side effects for those, then you can go into a lot of different ones. But minoxidil over the counter is pretty safe. And as long as you know that some people are allergic to it and recommend the foam over the other, you'll get by most of the time as a beginning treatment. And certainly if you have a shampoo like MONAT, or something that will also stimulate the new growth to come in, you would certainly think of that as one of the first things and easiest things you can do, without a doubt.
Very good. And you've recently started using, you were saying, for more your ethnic hair types, the hydration system.
Hydration system I've begun to use because one, I've talked about it, ladies of color, you tell them to shampoo twice a week and they go crazy. But you tell a white person, use this oil and they go crazy. I'm not using oil, no sir. So you have to deal with both ethnic groups to make sure that they're not going to use something, because you could give them the world, and if they don't put it on their skin, they're not going to get any benefit. Now, what I discovered a few years ago, the number one side effect for the FDA-approved drug called Propecia is, does anyone know what the number one feared side effect? Erectile dysfunction. Does everybody understand what that is? If you don't, the guys certainly understand what it is, but the girls maybe not. So it is just something, I mentioned it to a 30-year-old guy, a 40-year-old guy, and they run to the door. They just don't want it, okay? So, but years ago, we began giving the patients, and we didn't have any alternative at that time, and we gave everybody who walked in the door who was losing their hair, like a male, we would give them Propecia, Proscar. And we would ask them to take it, and a certain number of patients would call back and say, whoa, this is messing up my sex life. My penis is not nearly as hard as it used to be. And so we said, well, we don't deal with that. Goodbye. No, we said, well, let's see if we can't do something topically that will help that. And so that's when we began developing a formula that we called the formula to help use it so you can use it topically and not have an effect widespread. So that would be one of the things that we would strongly recommend. Is something like that, something as simple as that.
And you guys, it's great. Oh, go ahead. You have a question?
I got a question for my hair. I've been suffering from hair from breaks.
Yeah, breakage.
My front of my, let's show it to you guys. I don't get my edges in the front is all gone.
Okay.
Yeah, so I think your mom tried to treat my hair. I think she started a month ago.
Me too.
But I see little of coming up a little by little, but it's really damaged, really bad. So I don't know things like that. What I can do, I have to take medication. I have to do implants.
Well, implants generally don't work really well. Transplants, for instance, don't really work well in that area.
Okay.
So what you want to do first is to know, is there much inflammation associated with that?
Okay.
So when I look at a person like that with no history, I would say, did you have problems, and not problems, but did you have braiding when you were much younger?
Yes.
And then if the answer was yes, then we look at, well, let's take a little tiny biopsy and see if there's much inflammation. Because sometimes there's quite a bit of hair follicles under there, and there's still inflammation. Well, as long as there's inflammation, it will not regrow. So what we wanted to do is regrow. So first of all, we start looking at your thyroid. We look at your other hormones. We look at your vitamin D3. We look at your zinc. We look at your iron level. So menstruating females, their level can be way at the bottom, and we will never grow anything unless we bring that iron up or get the thyroid adjusted. So we adjust the body, and then we then look and say, well, if there's inflammation there, let's do little injections around the edge. And we've had several patients, really a lot of patients, regrow completely.
And that's where we've been using this.
This is where the MONAT comes in.
If you want to see edges get restored, this system will do it.
That would be the
who's had experience with it?
Well, I wanted to say to her, as a hairstylist, your first thing, your wig, because I see hair when I look at you. I see hair. So I'm thinking, let me ask you, Dr.
Yeah,
Edmond,
go
Dr.
right ahead,
Edmond,
say your thoughts. It's
This is my thought. Okay, so when you're dealing with hair, blood is what feeds that little white ball in your head at the end of the hair.
You're fine. Say whatever you believe.
So I would say to my clients, first of all, you put that wig on, you slowing the blood, you like closing, you're making it slower. And you do that every single day. Because I see hair, I know this MONAT will take care of you quickly. You closing that down. Then when you lay on it at night, we make it slows the blood down. So we got to, as black women, we got to take them things and let them go, throw them out. Because that's what's...
Well, part of it, wait a minute, part of it is your hairs tend to be really kinky anyway.
And soft, I mean soft.
And so at bedtime you've got to think, well, what am I going to do to this really kinky hair? I'm going to lay on it, whatever. And so wrapping it at bedtime is an old-fashioned custom,
I don't
and
know who
it
told us
works.
to do that. I don't know who told us to do that.
But it works, doesn't it?
Well, really, actually, it does not, because
Oh,
it
doesn't.
can't be jacked upside to the side like that. But you
At
just
a-
let
at
it
a-
go.
at a restaurant.
Well, you've got to be careful with your hair at night. That's for sure. And hair pieces like this, unfortunately, have little shears in the edge.
Yes,
And I always
they
just
pull
say
it out.
they pull it or
Yeah.
shear it
Yes.
so it breaks off.
And then on top of that, you lay on a cotton sheet or a pillowcase. So you see all this little hair. It's because our hair is soft. You was fed the thing that your hair was hard. Your hair is really soft. So you rubbing it off all night long. But I see hair around there. What I think, if I'm looking at you as a hairstylist, I'm not a doctor, but my first thing I'm going to say, you got to let that go.
And the cotton
Right.
that you're sleeping on is also drying your hair out, so you need a silk
Yeah, silk
or
is, we
different
recommend the silk.
type of fabric.
Take an old half slip that you don't wear anymore, put it on your pillowcase. Anything like that.
I use saffron. Decrease it.
Yes, perfect.
That's what I
Yeah, so that's one of the things that this company, when they did their studies, these studies were done for 3 years at Princeton University Consumer, so very strong clinical data. 90+% of the studies were done on ethnic hair types. That's one of the most difficult hair, as we are finding out, to restore or to regrow. And so we have so much confidence in the statements that we make related to the clinical efficacy with these products, such as a 48% decrease in that hormone that causes a lot of the problems, DHT, plus a 46% increase in hair growth and density. So you're getting almost 50% of something good, an increase, and 50% of decreasing. That's almost 100% improvement. That's why we're seeing such dramatic results literally within a couple months. We always tell people, give yourself a good 90-day cycle, because you will go through, especially if you've been using a lot of chemicals and a lot of product on the hair. It's like this floor. I've waxed it for years. If I want to get down to the floor, to the substrate, to the substance, I got to get all that wax off. So you're going to go through some detox phase. Not everybody, but a lot of people do. And you want to tell your, if you have friends or clients that are using this, to let them know, because they could get some shedding and they could get some things that they're not used to. So as long as they have an expectation set properly, they'll be fine. But that's what's unique, because the company that created this, just to let you guys know a little bit about, well, I was just curious, who's heard of MONAT before they came in here today? Maybe about a handful of you, not even. Of course, some of us that have been, working with helping to share the information for other people. What's nice is it's new. It's less than 3 years old, and they choose to go about, getting the word out there just like this, word of mouth. And as you know, and coming from the medical setting, especially in aesthetics and cosmetics, which is a cash-based business, your best patient is the one that comes from a word-of-mouth patient. It's somebody that's been referred from somebody else, and that's just how this effective product has grown in the market. It's so much so that this is now the fastest growing hair care line in the US and Canada, and most of you haven't heard of it. So great opportunity to help, share the word with some people. Second, very strong in terms of just company foundation. The company was started by a family from Venezuela. They live in Miami now. They originally, Senor Luis got his start, believe it or not, in Tupperware sales back in Latin America back 35 years ago. They opened a skincare line in his wife's name that's in 8 countries now. It's an anti-aging, naturally based skincare line. And so the company, when they started here, they started debt-free. They're a debt-free company. They have their manufacturing in Miami, and they have a manufacturing plant in Canada now as well. Canada, the market there has taken off. This is a global brand, but we're right now only in 2 countries. This will go to other countries. They are, like I said, they've been very successful in expanding a skincare line in several countries. So we are just getting started here in the U.S. In less than 3 years, the company thought they'd do $1 million their first year, and they did $25 million. And then this year, not even their 3rd year of operation, they were kind of thinking 150 million, and well over 400 million is what it looks like. This will be $1 billion company next year. And just as a comparable, it took Starbucks 25 years to grow to be $1 billion company. So they're on to something, And so what we're trying to do with great professionals is one, get this more into the professionals' hand, like Dr. Griffin. He's always ahead of the curve. I always look to him when he's been doing PRP for 15 years. Right? He was doing microneedling. When I started helping practices with the microneedling, I asked Dr. Griffin to do my first talk, because he had literally been doing some type of needling, started with a little hand gauge, 30 gauge needle.
Tattoo.
Like 20 years ago, So a lot of the things that are seem new to us, this surgeon and doctor's been doing them for many years. So I always look to him when it comes to, especially this area that he's an expert in, which is hair. And I've been very honored and excited that he's not only introduced me to the MONAT, but has brought that into his practice and is starting to see good results for his patients. What's nice is this is attainable because of the price point. So if somebody comes in and, sometimes the procedures can be a little more expensive than we can, stomach at the time. At least we'll get you on something, get you on some topicals and things that are going to work really well. And then, as your finances can afford the procedures, you can do those as well. But what's nice with MONAT, they really give you a couple different options about how you can, acquire the products. You can just buy them retail. You can be a VIP customer. I don't know if anybody's in here is a VIP customer. That's where you can save 15%. They'll ship the product automatically to your house. You don't have to pay shipping. It's nice because most of the time we forget to reorder product when it's running out. We end up getting something that maybe is not as effective put on the shelf. You don't have to worry about that with their VIP program. And then the third way is like myself, a few others here are what we call market partners. We've seen the opportunity to help, just get the word out there to help grow MONAT in Atlanta and into other markets. We have Adora, who's on our camera today. She's actually from DC, and she's good friends with another, Dr. Battle's a top dermatologist up there in DC, he's actually getting ready to really get into more hair rejuvenation.
Oh, so
yeah, with the plastic surgeon, I was going to tell you about that. And so we're excited because you're here obviously to hopefully learn a little bit more about possibly this is something that you could, do for yourself or help a friend. One of the things we're going to be doing today is some hair washing for those that are interested. More quick style though. We're just going to do a quick hair wash and blowout. We've got 3 really well-known stylists and expert doctor here that you can ask questions to. Up here on this computer, you guys, is a MONAT hair survey. So this is what you can come and take a few steps, just go through. I think it's 4 or 5 questions. And it'll help us identify some of the best products for you. We also have some of the specialists that can tell you that. Today, here at Blue, thanks for coming because this is a unique facility. Here we do a little bit of everything. We do hairstyling, we do laser liposuction, we do Botox, just everything to help you feel good and look good. We have a great weight loss program. We have great just massages and facials. Just for coming today, I've got all of you guys a gift certificate that you can leave with. They'll give you either a discount, $25 off, or I think it's about $125 in free Botox. So take advantage of that if you want as well. But I was curious if anybody have any questions for Dr. Griffin related to hair. And then what I thought we could do is kind of whoever wants to get their hair washed and blown out, we can start moving people in the back. But we'll be around. We've got mimosas and snacks, so we want you to help yourself and have a good time. Anybody have any questions? No? Okay, sounds good. Well, thanks for coming. Have fun. Let's wash some hair.
Okay, good. And you okay, can you send it to your email? Let's see. Okay, good.
Thanks, Dr. Griffin.